10 research-informed ways NAC may support health. NAC, short for N-Acetylcysteine, is not just another trendy supplement. It has a long medical history. Hospitals use it as an antidote for potentially toxic acetaminophen overdose, and it is also used as a mucolytic, meaning it helps loosen thick mucus in the airways. Beyond those established uses, researchers have also studied NAC for chronic bronchitis, mood symptoms, fertility, exercise recovery, and more. This video is for education, not personal medical advice. NAC may cause side effects and can interact with some medicines, so speak with a qualified clinician before using it, especially if you have a chronic illness, asthma, or take prescription medications. 1. NAC helps loosen thick mucus. One of NAC's best-known roles is respiratory support. It works partly by breaking chemical bonds within thick mucus, which can make secretions easier to clear from the airways. That is why acetylcysteine inhalation has been used alongside other treatments in conditions with heavy mucus buildup. 2. It may help some people with chronic bronchitis or COPD. When researchers pooled clinical trials in chronic bronchitis and COPD, NAC showed potential to improve respiratory symptoms and quality of life, and some analyses found fewer exacerbations in selected patients. That does not make it a cure, but it does make it one of the more seriously studied supportive options in chronic mucus-related lung disease. 3. NAC is a precursor to glutathione. Another reason NAC gets so much attention is because it helps supply cysteine, which the body uses to make glutathione, one of its major antioxidant defenses. That glutathione link is central to many of the ways NAC is studied, from oxidative stress to liver protection and inflammation. 4. Its most established liver use is medical, not detox marketing. A lot of supplement content talks about NAC as a liver cleanse, but the strongest evidence is actually in a medical setting. NAC is an approved antidote for acetaminophen poisoning because it helps limit liver injury when given appropriately. There is also evidence of benefit in some non-acetaminophen acute liver failure settings, but that is very different from broad online claims about detoxing. 5. NAC may reduce craving in some substance use disorders. NAC has also been studied in addiction medicine because it appears to influence glutamate signaling in the brain. Updated meta-analyses suggest it may reduce craving ratings in some substance use disorders, but the evidence is still considered weak, and researchers keep calling for larger, better trials. 6. It may have a role as an adjunct in depressive symptoms. In psychiatry, NAC has been investigated as an adjunct treatment rather than a replacement for standard care. Some meta-analyses report improvement in depressive symptoms and functioning, while others say the overall benefit is still uncertain and depends on the population being studied. So this is promising, but not settled. 7. NAC has been studied for male fertility. NAC has also been researched in male infertility. Meta-analyses and systematic reviews report improvements in semen parameters such as sperm concentration, motility, ejaculate volume, and morphology in some studies. That makes it an interesting area of fertility research, though it still should not be oversold as a guaranteed fix. 8. It may support some reproductive and metabolic markers in PCOS. In women with polycystic ovary syndrome, NAC has been studied for both reproductive and metabolic outcomes. Recent reviews suggest possible improvements in markers such as progesterone, endometrial thickness, LH, and some metabolic paraments, but researchers still describe it as a potential option rather than a definitive standard treatment. 9. Exercise recovery and performance are being studied too. Athletes and gym users often talk about NAC because of its antioxidant role. A 2023 systematic review found that NAC appears safe in studied settings and may help regulate glutathione balance and support some aspects of exercise performance, but the evidence was not clear across all outcomes like inflammation, blood markers, or muscle behavior. 10. Kidney protection is still a mixed area. NAC has also been tested for kidney-related outcomes, including chronic kidney disease and contrast-associated kidney injury. Some reviews suggest possible benefit, but other meta-analyses found that publication bias and heterogeneity make the picture less convincing than it first appears. In other words, kidney protection is still an area of debate, not a settled win. Safety and side effects. NAC is generally considered to have a favorable safety profile, but that does not mean side effects never happen. Oral NAC can cause nausea, vomiting, diarrhea, gas, and reflux-type symptoms. Higher doses may increase the chance of stomach upset and other unwanted effects. It also deserves extra caution with certain medications. Older clinical studies found that NAC can potentiate the effects of nitroglycerin, which may increase headaches and blood pressure-related side effects. That is one reason it's wise to check with a clinician instead of stacking supplements on your own. So, what is the honest takeaway? NAC is not magic, but it is more than hype. Its strongest uses are still as a medical antidote and a mucus-thinning agent. And beyond that, the research is most promising in areas like chronic bronchitis, craving reduction, mood support, fertility, and oxidative stress.